Welcome, friends. Mike Collins here, owner and pharmacist, Healthway Compounding Pharmacy in Saginaw. Here on our prescriber spotlight again with Dr. Keri Topouzian. Welcome,
Hello.
Dr. Topouzian.
Thank you.
Welcome
Nice
back
to be
again.
here again.
Thanks. So we've got an interesting topic today, a product called Dose Naltrexone. So tell me a little bit about Dose Naltrexone. What is it, Dr. Topouzian?
Low-dose naltrexone, very interesting medication. It's a prescription medication.
Okay.
It originally came out in the 80s, and don't let this scare you off, but it originally was made for heroin addicts because basically it's the opposite of an opiate. So patients would take it, and then if they shot up, well, they didn't get high. So that's the original reason why it came out. But then also in the 80s, there was a physician up in New York that started using it at a very low dose, like 4.5 milligrams, and it just really wasn't available that way. You had to get it compounded. And what they found is that it just very mildly sort of affected your brain, and then you got this rebound effect where you had a threefold increase in endorphins.
Wow.
That's the feel-good hormone that like when your runners get, like they're addicted to running. It
Sure.
produces that, but then it also does a couple other things. It increases your natural killer cells, which go around killing off anything that's a specific part of your immune system that sees something. It tags it. It says, hey, you shouldn't be here, and then it kills it off.
Oh, awesome. That's really good. So what do you mostly use it for? What's the most common reasons that you'd prescribe it?
So the most common reasons would be for pain, believe it or not. It's the opposite of an opiate, but it helps with pain. How does that happen?
Yeah.
Well, it
Interesting.
does. I know that's that you shouldn't go to a physician who says, if you ask them how is this helping me, and they just say, well, it just does. They don't go to that doctor anymore. And I just said that.
Yeah.
But the other things that we use it for are for any type of cancer, to boost your immune system, or different infections, chronic infections.
Sure. All right, cool. So what about side effects? What kind of things, or are there drugs that you can't take it with because of the way it works?
Right. You can't take it with any kind of opiate or narcotic. That's really the only contraindication, reason why you can't take it. Side effects, the main side effect that you get with it is vivid dreams.
Okay.
So usually we have patients take it at night, okay?
Right.
But if they start having vivid dreams, then we either lower the dose or we just have them take it in the morning instead.
Now, the patients I've talked to, they don't consider these dreams as nightmares. They're not Freddy Krueger type stuff. They're really just
Right.
kind of bizarre, and maybe it's just the fact that they actually remember their dream that it's kind of bizarre, whereas most of us, there's a lot of books that have been written on low-dose naltrexone. We actually have 2 patients that have written books on low-dose naltrexone and fibromyalgia because those are the conditions that they have. We also direct our patients because there's also been several documentaries that have been created because of patients and their effects and benefits that they've gotten. So we always direct our patients to LDNresearchtrust.org. That's LDNresearchtrust.org.
Larry,
We'll probably
David,
have
Nancy.
it down on the bottom here somewhere, right? I'm sure that our
Yeah.
expert
We'll fix
technician
it.
will be
We'll
able to
make
put
it
that
so
up there
it's
so you'll be able to see
easy peasy
that.
to
So
find.
we've been dispensing it for over 30 years and had some really great success. So anything else on LDN that you forgot to mention?
I've been writing it since 2004, and it's a great drug. I mean, I don't use many drugs.
Right.
Try to use a lot of supplements, but this drug, because it's pretty innocuous, no side effects, and
Right.
it just has so many benefits. I would like to mention a couple other things that are kind of interesting. In Scotland, they're using LDN for patients that are having problems with infertility. Okay.
Interesting.
And like if you're interested in finding out about LDN or being prescribed it, you can't just go online and buy it. You have to see a physician like me or
Right.
someone like me that's familiar with it.
And then get it at a compounding pharmacy
And then-
like me.
Exactly. You have to get it at a compounding pharmacy because it only comes in 50 or 100 milligram tablets at like CVS, Walmart, etc. But we're prescribing 1.5, 3, 4.5 milligrams, so you have to get it at a compounding pharmacy. So thank God for compounding pharmacies.
Yeah, hip hip hooray. So thanks again for being with us today,
You're
Dr.
welcome.
Topouzian.
My pleasure,
and
as always.
we're hopefully that we've given you a little bit of education. We'll give you some contact information to get a hold of either Dr. Topouzian or myself at Healthway Compounding Pharmacy. Live healthy, my friends.
All right, take care.